Hello, I am Dr. Sedgley. I am a primary care sports medicine physician. I work for MedStar Health. I'm one of the team physicians for the Major League Baseball Orioles. I do consulting physician for the NFL Ravens. I'm team doctor at Coppin State University, as well as Howard County Community College. I currently have the role of being the director of running medicine and the co-director of emergency action planning. Today we're going to review how to manage acute hemorrhage. This is a very important topic. We're going to hit many of these topics here today as part of our boot camp. This one in particular I think is important because it makes a huge difference. Let's recall that actually accidents and traumatic injuries are the leading cause of death outside of hospitals for people younger than age 40. Many times a third of pre-hospital deaths really are due to bleeding. And if you think about mass casualty events like shootings, almost 4 out of every 5 people in a recent study show they arrive to the emergency department not by EMS, not by a trained ambulance crew. And so knowing how to treat hemorrhage is critical, because a lot of times you'll see venues and activities and sporting activities say, well, we can always just call 911. And that's obviously part of a good plan in activating EMS. But by the time an ambulance may arrive, your athlete or the victim or the bystander may have already died. And so having these skills is critical. Death can be in less than 5 minutes for a significant hemorrhage. So we want to review this and remember, not everything's a mass shooting. You may be covering extreme sports where open fractures can occur with bleeding. You may be in a sport where it's hockey, where there's sharp blades on the ice, or the puck may hit someone at a soft tissue area. So we have to be available as a sports medicine physician to think outside the box with these skills. Now remember, these skills are something that we're going to apply in certain situations. Obviously, if someone has an abrasion or a minor wound, that's not a hemorrhage. And so we like to talk about really identifying who needs this care. Typically that is when the bleeding is more than half of the fluid that would be in a soda can. So today when you have your lunch and you have your soda can, pour half of it into a cup, or you get a chance one day to fill half a soda can up with water, pour it on the ground. That is enough to think that this may be a significant hemorrhage. Also, the quality or flow of hemorrhage can be very indicative of what you need to treat. If you have someone with a wound and there's pulsatile arterial bleeding, or just continuous blood flow coming out of a wound, that can be problematic. So visible bleeding is a key thing to look for. And sometimes you might not be able to see things initially because of gear, clothing. So checking for a weak pulse, pallor, this can be a reason why some people will be confused or obtunded. So when we talk about treating hemorrhage, there's just a few steps. And I think the first thing is we always have to work quickly. But remember, we don't want you to become the next victim. You as a physician or healthcare provider with part of a team of athletic trainers, physical therapists, it takes many, many years to train you. If you're injured, you just become more of the victims. So make sure that the scene is safe and ensure your own safety. And then what you want to do is look at your athlete or your bystander and say, is there that indication of hemorrhage? Is this a life-threatening bleed? Do I have an abrasion? Or maybe this can wait a little bit, or some direct pressure with a cloth can handle it. A lot of times you'll see in many venues next to the AED, you'll see hemorrhage kits available. Maybe you'll have an ambulance on site for your sports venue, and you can ask yourself, is there a trauma kit available? Now maybe there isn't. Maybe you're in a austere environment covering an ultramarathon and someone's fallen off a cliff or hit their head on a tree after falling. You may just need to use clean, dry cloth and do direct pressure. That's the best you can do in some situations. However, let's say you do have some options. You also want to ask yourself, where is this wound? Is it in a limb? Is this in an extremity? Or is this in a neck, axilla, or groin, kind of junctional area? Obviously, if you're in an extremity, you're going to be looking to wrap and use a tourniquet. If you're talking about something where like it's a neck or groin, that's an area we're going to pack a wound. Neither one of these feel great when they're occurring, so you want to discuss that with the victim to ensure them you're trying to help them and why it may be problematic for them, because it's going to hurt. So packing in direct pressure, you want to actually expose the wound, see it, and if you actually have some gauze or a trauma kit, putting that in there and then applying direct pressure is key. You'll see I like this picture because this caregiver, while providing care for the hemorrhage, is wearing gloves. Please do not put yourself in danger. Always have your gloves with you. It's easy to put them in your back pocket on the sidelines. If you don't have them there, usually in your sideline kit or your bag, it's important to always protect yourself first. Tourniquet application for limbs. This is something I think we should all feel comfortable with. Whether this is pulling over the limb, twisting and clipping. In this slide, we have someone wrapping an extremity that's bleeding, taking that bar and twisting the windlass. And you do that probably at least 3 times. Again, it's not going to feel great, but you have to let them know this is going to save their life. And then you want to actually secure that bar. And then we write down a time. And usually they can leave these on for at least 2 hours before you're going to get any peripheral nerve problems. But obviously, if you had some numbness and tingling later, but you lived, you have to weigh that out. I think the time is exceptionally helpful when you get that person to a higher tertiary level of care center and they know what they're dealing with because you've given them some information.